ISBAR is a form of communication that provides a simple but effective way of prioritising information when communicating about a patient and their situation to the supervising sonographer or reporting radiologist. It stands for Identify, Scan Type, Background, Assessment and Report or Recommendation. This video aims to portray the correct method of communicating the patient's information and scan findings to the reporting radiologist using the ISBAR method. The I in ISBAR stands for Identify the Patient. This means that the patient's gender, age and any other relevant details are shared with the supervising sonographer or reporting radiologist.
Hi there, my name is Krishan Kishore and I am the student sonographer today. I've just completed this patient scan and I have evidence to believe that they may have peripheral arterial disease. This needs to be verified by the supervising sonographer and be brought to the attention by the radiologist. Firstly, I must share the basic information about the patient. This information includes their name, gender and date of birth. This will allow a concise and simple overview of the patient's case so that my supervisor will know exactly what I'm talking about. It is also handy to have the referral with you when you're communicating with your supervising sonographer, as it will contain most of this information. I'm going to have a chat with my supervising sonographer about the scan. Could you please wait in this room? I'll be back shortly.
No problem.
Hi supervising sonographer, can I please discuss my last case with you? I've just scanned Mr. Joe Blake. They're 59 years of age.
The S in ISBAR stands for Scan Type. This requires the sonographer to explain the type of ultrasound scan performed.
I was requested to complete an arterial study on his left leg, including measurements of the ankle brachial index for query of peripheral arterial disease.
The B in ISBAR stands for Background. This means communicating the patient's clinical history, family history or any other relevant details to the supervising sonographer or reporting radiologist that could impact the patient's diagnosis. This could even be that the patient has a latex allergy, so the supervising sonographer knows to use latex-free gloves if they would like to scan the patient themselves.
While I was in the room with the patient, they told me about some of the symptoms they were experiencing along with the previous medical procedures that were performed. Some of this information wasn't relevant to the scan, so I must decide what information should be relayed. Some background information can be found in referrals or on previous worksheets. Joe, what signs or symptoms have you been experiencing? Have you had any pain?
I was feeling pain in my leg mainly when I had been walking. That's what made me go to the doctor. It hadn't been going on for too long, but it kept getting worse. It seemed to be going away if I sat down and had a break for a little while. I once broke my leg when I was younger, but I can't remember if it was left or right.
Okay, I see. Do you have any idea when you started getting pain when walking?
It started about 2 months ago.
Do you know if anyone in your family that has had the problem with their veins or arteries in their legs before?
My dad had something similar to this once. He said he had leg pains and eventually he had peripheral vascular disease.
And do you have diabetes at all, Joe?
As a matter of fact, I do.
The patient had claudication when walking for approximately 2 months. He has also had diabetes and a family history of peripheral arterial disease.
The A in ISBAR stands for Assessment. This requires the assessment of the ultrasound findings, as well as any difficulties encountered or any extended study that was performed is given to the supervisor.
The patient had an ABI of 0.5 with biphasic flow at his groin, which became monophasic as I scanned the leg distally.
The R in ISBAR stands for Report. This means reporting your provisional and differential diagnoses based on your scan and how it relates to the clinical question. You can then ask the supervising sonographer or reporting radiologist for recommendations and what the next step to take is.
The patient's ABI and distal leg monophasic waveform is suggestive of peripheral arterial disease. His ABI is within the ranges of 0.4 and 0.6, which correlates with the severe claudication he is experiencing. What should I do next?
I agree this is suggestive of peripheral arterial disease and will tell the reporting radiologist.
Notice how the supervising sonographer communicates incorporating all aspects of ISBAR.
My student sonographer has just scanned Mr. Joe Blake, who is 59 years old. This was an arterial ultrasound of his left leg. The patient has had claudication for 2 months, has diabetes and has a family history of peripheral arterial disease. They got an ABI of 0.5 and found monophasic flow distal to the left groin. This seems to be suggestive of peripheral arterial disease. What do you believe should be done next?
I will look at the images and worksheet and decide if further imaging is required. In the meantime, leave the patient in the room so if necessary this can be carried out.
Okay, I will. Hi, I'm one of the supervising sonographers. I've just spoken to the radiologist who is going to look over the scan that my student sonographer did and decide if any further imaging is necessary. Could you please wait here a little while longer while they make this decision?
Sure.
Thank you. I have spoken with the radiologist and he is happy with the images that he has. A report will be written up for your doctor, so in a week's time make a follow-up appointment with your GP and they will notify you of your results. Thank you so much for your patience. Do you know your way out?